Welcome to Face the State. I'm Ariana Bennett. Thank you for joining us. Well, Alzheimer's disease is the most common form of dementia, affecting millions of patients across the country. But despite its prevalence, there's no known cure for the disease, and nobody fully understands what even causes it. And that leaves us with a lot of patients facing a slow decline who will eventually need round-the-clock care. Jacob Harmon, the Regional Director of the Northern Nevada Alzheimer's Association, is here with us to talk about the issue here locally. Jacob, thank you for coming on the show.
Thank you, it's a pleasure.
Now, really, it's such a common disease. I think just about everyone's connected to it somehow. More than 40,000 people just here in Nevada, and those numbers are growing. Do we have any idea why?
Absolutely. The scope of the impact of Alzheimer's disease is really staggering. More than 5 million Americans, more than 47 million people affected worldwide, and about 41,000 here in Nevada. And the reason for that is really due to the shifting of demographics, particularly here in Nevada. We're the second most rapidly aging state. So the primary risk factor for Alzheimer's disease is age. Your risk for developing Alzheimer's or a related disorder goes up after you turn 65. And here in Nevada, we have a lot of people retiring here. They come here for a little slice of heaven. And then unfortunately, many of those folks are diagnosed with Alzheimer's disease.
So it's not necessarily that a greater portion of senior citizens is getting diagnosed, it's more that we just have more senior citizens?
Absolutely.
That's kind of a concerning prospect when you look at the future of our state, really the future of our nation as boomers age more, but Nevada in particular. How do we manage that?
That's the challenge. Alzheimer's disease is challenging for families on a number of levels, but it also presents a public health crisis. Like you said, as the baby boomers age, 10,000 people turning 65 in this country every day. Right now, 5 million Americans. By 2050, by the middle of the century, we'll have 16 million Americans living with Alzheimer's disease. Between now and then, 60 million Americans will have died with Alzheimer's disease. And so, putting aside the tremendous human cost of this disease, the financial ramifications to our healthcare system and to the federal and state governments is tremendous, estimated to be at $1 trillion by 2050.
It's a really, really scary thing, I mean, all around. But I think the biggest issue is that as the disease progresses, you're faced with people who need not just periodic doctor's visits, they need constant help and care because they can't function without it. And we're also talking about a population that often lives on a fixed income. So does the state end up, or the federal government end up shouldering most of the cost of this?
Absolutely. It cost Medicare and Medicaid $236 billion last year to treat Alzheimer's disease. And while we're spending that kind of money treating Alzheimer's disease, we're only spending a fraction of that on research. So until recently, the federal government at the NIH level spent only $400 million on research, while we were spending 26,000 times that on treating Alzheimer's disease. So a lot of what the Alzheimer's Association does is sort of fill in those gaps. We are committed to ending Alzheimer's disease through the advancement of research, through enhancing care and support for all affected, and through the promotion of brain health.
Okay, so let's talk about the research real quick, because it's always nice to see if there's any kind of ray of hope. So is there promising research happening about what causes it and how we can possibly treat it?
Absolutely. There's been a lot of really exciting research that's come out over the past decade. The Alzheimer's Association, we're the largest private nonprofit funder of Alzheimer's research. Thomson Reuters recently ranked us as the third most impactful organization on Alzheimer's research, behind the US government and the Chinese government. And what the Alzheimer's Association does is we fund young researchers with new and exciting ideas to bring them into the field of Alzheimer's research. So for instance, about 10 years ago, we funded some young researchers out of the University of Pittsburgh, and they were able to, for the first time, identify the plaques and the tangles, these proteins, abnormal protein buildup in the brain that many believe cause Alzheimer's disease. So as a direct result of Alzheimer's research funding, we've been able to identify the culprit, we think, of Alzheimer's disease, and we've also been able to identify the buildup of those plaques in pre-symptomatic people as early as 20 years before the onset of symptoms. And this opens up a whole wide range of treatment possibilities where for the first time we're actually doing preventative clinical trials for Alzheimer's disease, because we can identify people, take pictures of their brains before they start developing Alzheimer's disease, identify them at high risk, and start providing them with medications that we think will slow or maybe even prevent the onset of the disease.
That's great to hear, because as of right now, a diagnosis is basically, well, this is your life. Like, you're gonna have to live with this for as long as you live with it, and there's really nothing we can do, right?
Absolutely. It's the 6th leading cause of death in the United States. The most recent study estimates that about 500,000 people a year die with Alzheimer's disease. And while there are a lot of really encouraging new developments, we still have a long way to go, which is why the Alzheimer's Association is not only committed to advancing research, but also providing care and support for the millions of people in this country affected. So one of our mottos is nobody should have to go through this alone. So we have a 24/7 helpline. It's a 1-800-272-3900. You can call that number 24 hours a day, 7 days a week, talk to an employee of the Alzheimer's Association. When my office here in Reno is open, you'll talk to one of my staff members here locally. When we're closed, you'll talk to our national office in Chicago. And we can provide answers to questions, emotional support 24/7 in over 120 languages.
It's a difficult diagnosis for a whole family to deal with too. It's not just the patient. So what kind of resources are most important to provide to Alzheimer's families?
It varies. When you've met one person with Alzheimer's, you've just met one person with Alzheimer's. Every family's needs are different, but almost exclusively building a support team in the community, whether it's families, whether it's friends, whether it's professionals, to support the family caregiver in supporting their loved one with Alzheimer's disease. And our families, after they've gone through this experience, they almost exclusively report that support groups were the place where they started to do that, where they could come every month, twice a month, and be in a room full of people who understood exactly what they were going through and were there to help them through it. So the Alzheimer's Association, we have 14 support groups throughout northern Nevada, all led by our tremendous team of volunteers who have been through this with their own loved ones and are now dedicated to helping other people cope with it.
Okay, what do you think our community is most lacking? What do we need more of? Or what do we need, period?
We need a lot. We need better communication and partnership with our physicians. Half of the people who are living with Alzheimer's disease have been diagnosed with Alzheimer's, and only about half of those who have been diagnosed have been told of their diagnosis. And frequently, just because of the demands placed on physicians, they're not in a position to have comprehensive knowledge about the community resources. So we work very closely with our community partners, physicians, hospitals in the area, to educate doctors that we can help them 24/7, sort of build that care team for their patients. We can work with the physicians. But another really important aspect of this is community involvement. Many people, upon having a diagnosis of Alzheimer's or feeling those effects, they withdraw from their community. It becomes harder for them to have a conversation. It becomes harder for them to remember their friends' names. And so instead of being out there, they withdraw, and that social isolation is really dangerous to people living with the disease and their family care partners. So community building around engaging people with Alzheimer's disease in the community. So recently, in partnership with the university, the Retired and Senior Volunteer Program, as well as the Truckee Meadows Parks Foundation, we started a series of walks at Idlewild Park for people living with dementia and their family caregivers to come learn about the park and the stuff that's happening in the park, but also connect with other people, because that social connection is so important for brain health.
What about a physical place for them to live when it advances to a stage where they need round-the-clock care? Those are really expensive. Is there enough of that in our community that people can afford?
It certainly can be expensive. There are a wide range of options from group residential homes to memory care facilities. Our goal at the Alzheimer's Association, because cost is such a challenge for many of our families, is to give the caregivers the tools that they need to keep their loved one at home for as long as possible. In our early stage programs where we talk to people living in the early stage of the disease, almost exclusively they say that they would like to live at home for as long as possible. And so we want to enable that. But we do have some excellent communities throughout the state, but particularly in this community, who are providing that care at various levels of cost.
Good. Okay, we have just a little bit of time left, so I want to talk about what you need from the community, and then I know you have some fundraisers coming up.
Absolutely. We need community involvement. Like I said earlier, we had the funding level of Alzheimer's research was at $400 million. If the appropriations package that the House is considering right now passes, Alzheimer's research funding will go up to almost $1 billion. And that is a direct result of volunteer advocates from the communities meeting with their federal legislators. So we always need volunteers to call their congresspeople, but also to come out to our Walk to End Alzheimer's, which is September 24th. It's our biggest fundraising event, which raises money for our local programs and services, but also Alzheimer's research. But it's also an advocacy event when 1,500 people show up at the Sparks Marina dressed in purple, saying in one unified voice, "We are the national movement to defeat Alzheimer's disease." Our elected politicians, they listen to that.
Okay, one more time, when's that happening?
September 24th at the Sparks Marina.
Okay, perfect. And then, of course, I assume you guys are always taking donations.
Absolutely. You can find out all that information at our website, alz.org.
Okay, perfect. Jacob, thank you so much for your time. I
Thank
really
you.
appreciate it.
Appreciate it.
Well, coming up on Face the State, those who live in remote parts of Nevada face a unique challenge when it comes to healthcare, having to drive for hours or be airlifted to the nearest hospital. But new technology is helping bridge that gap. We'll talk telehealth right after the break.